And a bright good morning to everybody. How's everything going out there? Chronic pain land, medical marijuana, patriot, everybody. Hi! It's foggy as hell here. Check this out. We very seldom get fog here. Don't know how well you can see it, but that's our driveway way down there. We very seldom get mist and fog here. So I grabbed a few shots of it. It's very, very rare. We get a temperature inversion where the dew point is just barely keeping the moisture hanging in the air instead of falling on the ground. That's, in fact, it didn't start till the sun came up and started to melt to warm up the earth and put all the moisture up in the air. But we're going to go inside and we're going to talk about pain again. Because pain and marijuana and opiate therapy, all those go together. And I've got lots of facts and information on pain and how it's relative, subjective, and comparative, all depending on who's the one in pain, who's looking at you in pain, or how you're looking at somebody in pain, and, how to tell the signs. Some people will hide their pain. I'm really good at it. Debbie actually gets feelings where she says, "Are you alright? You look alright." I say, "No, I'm just trying to stay happy through a flare. That's all." And that's the way it goes with me. Because I get all sullen and shit. Debbie really feels that. We're both empathic. We both feel each other. From, 3 feet away from each other on the couch. And we practically read each other's minds. It's really nice. She's the wife number 4 for me. I'm her number 1. And only. Don't foresee a divorce on the horizon here, since all my marriages lasted 18 months after I do. And we are now working on our 9th year. Yeah, we bought this house in December, right near the end of the year. So we're coming up on 9 years, from 08 to 16. Could be starting our 10th year after the first of the year. Well, time to go in. I'm going to pause for a second here. See you all inside in a second. And we're back. How's it going? I just put on my Mary's patch. See it in there. Because we're going to town today. Because the dispensary is going to be closed Saturday and Sunday. And today is their last day of their Christmas sales. Everything in the store. No limits, no restrictions. Buy one, get one half off. Well, I've been told that these batteries only last 6 months, depending on how much you use them. Mine's almost a year and a half old. And I'm going to get 2 batteries, half off on one. I'm going to get myself 4 vials. So that'll be like 3 for the price of 2. Or 4 for the price of 2.5, 3, whatever. Let's get back on subject. Pain. What did I talk about yesterday? Pain is relative, comparative, subjective, all depending on who's looking at it and which direction you're looking at it. Are you looking at it from the inside out with the pain? That's where you're subjective. Doctors look at you as comparative, and you need to go through the comparative scale and tell them what you feel, what numbers you feel. from the 1 to 10 scale. 1 being no pain, nothing, everything's normal. Which there actually should be a 0. It should be a 0 to 10. 1, that would be like your minor headaches, growing pains in children. Okay. 2, 3, 4, everything. The farther up you go, the higher your pain levels. And I gotta tell you, I have been on every number from 0 to 10 in the past 12 years. 9, almost 10 years. 10 years of knowing Debbie. 2 years before that, I was still living up the road a little ways outside of Tucson. And I was living with a lady that we finally broke up because I started working down here in Tucson for my sister in real estate. Mistake. Never worked for family, especially a cantankerous wench like my sister. But pain itself is relative to the one in pain, and you're the one that has to come up with the descriptions for your pain. Like mine. Mine, sometimes I liken them to army ants. Just imagine army ants, a big blob of them. I've had a feeling like this size of a mass traveling all over my body, like ants just walking. But their feet are dipped in acid and my nerves are turned up on the outside of my skin. That's what it feels like. It's a cross between ants burning everything in this little amorphous mass that just moves all over the body. I've had it move right across my eyelids. I couldn't touch my eyelids. It felt like I had rubbed my eye with sandpaper. That's fibromyalgia. That's a part of fibromyalgia. 200 plus symptoms to fibromyalgia alone, which makes it a very hard disease to diagnose, because so many pains can come from so many different directions. My own brand of green chai iced tea. Make it myself, it's great. But that's what it feels like to me. It feels like sandpaper has abraded and my skin is just crawling with pain. Just a crawling, moving mass of pain that goes all over the body. Very, very disconcerting. Very disconcerting. My opiates just barely keep that in control. With marijuana and Seroquel, Valium. And then I have my amitriptyline for bedtime. A Seroquel, my 50 milligrams of amitriptyline. Sometimes I need my 4th morphine also. But I sleep great. And I've been taking the CBD hemp oil from Tracy at hempsavedme.com. CBD Hemp Saved Me Facebook page. Tracy's products are awesome. I've already told y'all the story of my wife. Her friend back east with ovarian cancer, doing great on the products. She was doing bad on chemo. So I told my wife, please tell her to order Tracy's products. She did it. Fixed her. Tracy has somebody else that has ovarian cancer fixing it with hemp oil. Non-psychoactive. You don't get the euphoria that you get from THC, which is in cannabis, not hemp. Hemp has 0.3% THC or less. 0.3%. I smoke 20 to 25%. So that tells you the very vast difference in the THC content between cannabis and hemp. Hemp, there's nothing. There's not enough to get a baby high. That's it. CBD, I told you, is so safe that your child could drink a whole bottle of orange oil and it's not going to do anything bad to them. It's going to go to all the ECS receptors in that child's body, and it will heal whatever might be in there. Like Debbie, we did not know what was wrong with her. All we could get was the IBD diagnosis, but there were too many other things unconnected to IBD, so we have no idea what she had. But the chaga mushroom with 10 milligram CBD pills fixed her in less than a week. Turned her around 180 degrees from being a skeptic to being a believer. And she's still telling me it's not the miracle cure, but it is the greatest, best, closest thing to a total miracle cure for the human condition and for our pets and children. Hemp oil is safe for all vertebrates. Totally safe, non-psychoactive, non-addicting. You don't even know you took it until you start feeling better. How can that be? How can the DEA tell us that that's going to be a Schedule 1 narcotic come January 17th? It's bullshit. And Congress has to pass this too. Okay, the DEA alone cannot force this legislation through. And Trump has already said that he wants to legalize countrywide. Well, come on, Donald. I voted for you because of that. Do it. Make marijuana legal in all 50 states. Even if it's just medical. 50 million people. They figure 1 in 50 has chronic severe pain, equaling 50 million people. 3 major diseases with chronic pain. Chronic pain is the 4th. The other 3 diseases. 21 million people diagnosed with diabetes. 14 million of all cancers combined. 28 million with heart disease. You add all 3 of those together, you get 63 million people. One problem only, chronic or severe pain. 50 million people. The 3 highest diseases there are just barely beat chronic and severe pain by just a difference of 13 million people. Imagine that. It is the scourge. This is worse than cancer now. Chronic and severe pain has come up. Fibromyalgia has blossomed. And they're positive that people used to suffer from it, but they didn't know what it was back then. But more and more people are getting it. And it could be our GMOs. It could be our foods. Okay, people come up with gluten intolerance. Gluten? It's in pizza dough. Okay? It's high gluten flour is what they use for pizza dough. If you got a gluten allergy, you can't eat pizza. Unless they make a special crust. They can make whole wheat crusts and stuff. Maybe they can make some that don't have the gluten in it. But that's a basic staple of pizza dough is high gluten flour. Okay? A study by the National Institute of Health that 1 in 3 Americans have experienced pain of some sort within the last 3 months. And the 50 million chronic and severe pain with the 63 million people of 3 other diseases as a comparison. It's stunning, just the number of the pain. This is a major epidemic. And unlike diabetes, cancers, and heart disease, therapy for chronic and severe pain has not improved in hundreds of years. Yes, hundreds of years. Chronic pain has not been fixed. In 2012, 250 259 million prescriptions were written for opioids. 259 million. Okay, that's going from the smallest oxycodone and hydrocodone that you get at the dentist for your tooth pulled, all the way up to OxyContin, heroin. Okay. Marijuana does not belong up there. Marijuana does not belong on the schedule of narcotics at all. CBD from hemp does not belong. It doesn't even belong to the DEA. They should have no say in industrial hemp, because industrial hemp is not a drug. It's non-psychoactive, non-addicting. You cannot say that this is a Schedule I narcotic with no medicinal benefits. And you cannot say we need more clinical trials. Why do I say that? Because right now the Big Pharma is pushing pills out so fast. 100 to 200 new medications every year in a last-ditch effort to keep marijuana away from the public. Because medical marijuana does not pay Big Pharma anything. You curing yourself with cancer from hemp oil loses them money. So it's all about greed. So, why do we suffer severe and chronic pain and we can't get medical marijuana? Because Big Pharma is keeping it illegal. Because they lose money. If they would just look at it this way, instead of a DEA, make a DRA, Drug Regulating Agency. They can grow wheat, hemp, and cannabis, compete in the marketplace. And instead of $15 billion a year into the drug war black hole where it never comes back, the DRA can actually work for a profit. By paying farmers, take the $15 billion and pay farmers to grow hemp and then grow cannabis. Sell it. Make money for the DRA instead of spending money with the DEA. Make $15 billion a year instead of spending it. Okay? And we can do that with hemp crops and cannabis crops. Okay? They can compete fairly in the marketplace. Okay? Say there's 12 dispensaries in your city. Okay? The government can come in and do less than half of that so that they don't monopolize. We don't want Big Pharma monopolizing anything anymore, because that hurts people. It creates more pain patients. Okay? Legalize hemp and marijuana. Grow it. Sell it. For hemp-based medicines, cannabis-based medicines, and hemp industry. 50,000 plus uses for industrial hemp. Okay? It's not a narcotic. Marijuana is not even a narcotic. It gives you a feeling of euphoria, having health. You don't trip. Okay? You don't do what they did in Reefer Madness, pull out a gun and, boom, shoot somebody and go, well, look, I shot him. That movie was nothing but stupid-ass propaganda. Anybody that believes in it, please don't. You're being stupid. 259 million scripts for opioids. Just imagine this. This is non-cancerous chronic pain only on this. This is not we're not even talking about the opiates for people who are laying in bed dying of cancer with a button for their morphine. Okay, that's not even included in this. Okay, a big part of that 50 million that suffers severe and chronic pain every day have cancers and have to dose themselves with marijuana, with morphine, high doses, because of their pain levels, because it kills you. The pain alone kills. It can make people check out. Okay? It'll make people want to die. It's not right. So, There's new CDC guidelines coming up on opioid use to treat non-cancerous chronic pain, and they are warning doctors to consider the risks and benefits of opioids. But the fact is, however, that opioids are used for chronic pain not because it's an ideal treatment, but that for some patients the benefits outweigh the risks. And that's the whole thing. It's very hard for doctors to see your pain unless they're empathic, like mine. My doctor saw my pain. He saw me in 10/10 pain, and he believed. Okay. Hi, Doc, if you're watching this, I've invited him to watch all my videos. So, the best thing ever is morphine and medical marijuana together. They are the perfect combination to help with chronic pain. Adding the hemp oil has increased my quality of life even more than that extra morphine and the marijuana has. It has helped me. Pain. What is pain for? Pain protects us by reminding us that we hurt. Okay? The main concern for those who study chronic and severe pain is that it can last from hours to months, serving no useful purpose, and no warning for us to slow down. It just happens. And there is not just one type of chronic pain. There's arthritis, fibromyalgia, what I have, degenerative disc disease, stenoses and spondyloses. My discs are extruding out and pressing on my spinal cord. I've got bone on bone from my vertebrae because my discs are almost gone. And I have this all up and down my spine. And on top of that, I have the skin creepy crawlies. And sometimes I feel like my entire body's been run through sandpaper, just sandpapered every inch of my body, raw. It's not a very good feeling. Now, there's 3 types of pain broken down here. There's sensory discriminative. This refers to the actual direction, location, and intensity of your pain. And it's a result of direct nerve pathways from the body to the brain's cortex. Now, there's affective motivational pain. This arises from your pain circuitry interacting with the limbic system, which is the emotional center of the brain. And this is part of the fright, flight, fight syndrome. And this adds emotional flavor and evokes anger or fear. Now there's cognitive evaluative. This is the conscious interpretation of pain signals that combined with other sensory information. And this dimension draws on the different aspects of pain processing, allowing us to determine location and potential severity of our pain. The pain sensory system itself is part of our survival instinct. Okay, it's a default programming that shows that to treat our survival teaches us to avoid harm. Okay, with chronic pain, as opposed to acute pain, is the affective. It is not motivational dimension. It becomes dominant, leading to psychological consequences. Thus, suffering and depression are much, much worse for chronic pain patients than it would be for the equivalent of an acute injury. An acute injury is like you break your bone. You get it set. Then all you got is itchy underneath the cast. Okay? That's your lowest pain. That's okay. Where did I go? Okay, much worse for chronic pain than the acute. The multifaceted nature of pain itself is why opioids are oftentimes the only effective agents for both moderate, severe, acute, and chronic pain. Opioids act at all levels of the circuitry as they suppress incoming pain signals from the peripheral nerves in the body. And importantly, for chronic pain patients, they also inhibit the amplification of these signals in the spinal cord, and they improve the emotional state of the patient. Unfortunately, many patients rapidly develop tolerances to opioids, which over time significantly reduces their effectiveness. And this is where medical marijuana helps. Medical marijuana added to opiates therapy helps this. It helps you from becoming addicted to the morphine or opiates, and it attenuates the symptoms of withdrawal so that you never get nervous and jerky and withdrawal symptoms of, oh God, I missed my morphine, I gotta have it. You don't. Medical marijuana helps that, and the hemp oil is helping it too. Okay, this is something that people with severe and chronic pain need. We need to legalize marijuana for medical necessity. And the DEA needs to leave CBD, cannabidiol, alone. Why? We don't want big pharma poisons anymore. We don't. I'm speaking for everybody. I'm hoping everybody's on my side here in saying that we don't want to suffer. We want to be able to medicate with a plant that is safe. In 10,000 years of clinical trials and no deaths. Okay, Big Pharma's pushing these poisons out so fast, you cannot tell me that they're doing accurate clinical trials. There is no frickin' way, okay? Because that would be millions of dollars and lots of people being pulled into these tests, okay? I was on the list while I was still driving. I was on the list for my local testers, the people that do research for Big Pharma, the ones that help do the clinical trials. I joined one for COPD and asthma. Medical marijuana fixed my COPD, so I didn't get that study because my lung volume was perfect. My lung volume was that of a 20-year-old after smoking weed and 40 plus years of cigarettes, and I still had the lungs of a 20-year-old. Yes, I could take in a lot, and I could blow out a lot of air. Okay? But I get sidetracked here. Pain. I'll be bringing up more pain after the holiday break. I'll see if I can do some videos while Debbie's off. It all depends. I don't usually have an audience sitting next to me except for the dog back there. She's there. Hi, baby. But I'm going to have to cut this off at 29 minutes. Pain is chronic and severe pain. Need opiates. And medical marijuana. Okay? Send this up to state level. And higher. I don't care if this goes to the Oval Office. I don't want Mr. Trump to see a chronic pain patient say that medical marijuana does not belong on the narcotic schedule. Hemp-based cannabidiol does not belong anywhere near the DEA. The DEA should have nothing to say about cannabidiol because it is not addicting, psychoactive, nothing. It's pure body healing. And to deny that healing to us is doing a very large disservice to the citizens of America and of other countries. So, peace out. I'll be bringing up even more stuff on pain. I'm going to be doing a lot of research, and I hope everybody gives me comments and topics. Stop this before 30 minutes. Give me comments, give me topics, and let's free marijuana from the prison of ignorance. Bye.